course, you're going to want to know what your blood count is. Also, what is your iron status? You're going to need 1,000 extra milligrams of iron in you to support this pregnancy.
When my mum was in hospital, she had a complicated surgery, lost a lot of blood. She was in intensive care. We noticed that in testing her blood so regularly, they were taking several vials of it, and just thinking in our minds, shouldn't she be hanging on to that? They switched to using microsampling. So very small needles, the type they normally use for very small babies, small amounts of blood taken, managing the blood that my mum had very carefully certainly contributed. She was home about a week later.
I've had my form of anemia for over 15 years, maybe 20 years now. I learned about micro blood tests. No one has ever told me that I could do smaller blood tests to help increase my blood levels. That's a lot of blood that I can't really give up anymore. What other questions could I be asking my doctors that I never knew to ask?
Every laboratory scientist knows what the minimal draw amounts are for every given test. And so if you struggle with anemia, then it's an appropriate question to say, what is the minimal amount of blood you need to draw so that my blood can be tested for what you're wanting?
That's where we've seen the most impact, right there in the community. We just need a drop of blood. We'll know if the blood level is low, and then we can do further investigations. We also don't believe in making them scared of healthcare professionals, or as we call it, white coat syndrome, where they're afraid of speaking to the doctor, the nurses, or the pharmacist. So we go with regular t-shirts so they feel comfortable having discussions with us. And these simple complaints may just be caused from iron deficiency, simple supplementation or anemia.
When I go to the doctor, I know exactly what I'm going to ask the doctor, showing them that I actually understand what's going on with my body. Just going and say, hey, I've never had a blood test done. Do you think I can get that done?